Chronically Spicy, and I have made it finally to Florida with my daughter and our two dogs because I have an appointment tomorrow with a specialist to be evaluated for a condition called relapsing polychondritis, which I will explain to you in just a few minutes. First, I want to see if this is actually live on my YouTube channel. Because I don't know if it is. I don't see it going. This is me learning how to multi-stream. To check Facebook. All right, so it turns out one of the things I was trying to figure out why I couldn't stream to the Chronically Spicy page, and that's because the I'm gonna share it to my page though. I can't share it to the group because I'm sorry, to my Chronically Spicy Facebook page, because that requires paying for a monthly subscription, and I don't have the $16 a month to do that. So that means I stream and it shows up on my regular account, and I just copy the link and share it on my other here. I'm gonna go to Restream and show you as I. All right, so I have a Facebook group called Chronically Spicy and the Spicers, and it's free to join. This is not supporters only thing. I forgot my YouTube or my name on here. Really? Let's see. We have had one hell of a day. All right, so post. Copy and then post. Now we're going to, well, actually, let post first. I have 20 members in there right now. And I would love for you to join. Like I said, it's free. And I'm trying to get more involved in what I'm posting over there, and maybe some behind the scenes stuff. I do have a Patreon. I do have everything's in my link tree. But there are benefits. I'm on TikTok because it's the easiest app for me to use to record. However, it's not my favorite for a variety of reasons, including the fact that, somebody can report a live for arbitrary reasons and get your live access removed, which sucks because as a member of the chronic illness community, we are sharing information that we need to share with each other so that we can learn from each other's experiences, because our doctors, not all, but some, and by some I mean most, because the good ones I can name, out of all the doctors I've had in my adult life, I can name Dottie, nurse practitioner, Dr. Krebsock, Dr. Min, um, who was my allergist in Tucson and told us we had to move because, hey, guess what? I'm allergic to everything. Um, and my current provider. And my nurse practitioner that diagnosed me with, officially, clinically, mind you, with mast cell activation syndrome. And my provider is also my daughter's provider, and she diagnosed a little bit with, she's 16, with mast cell activation syndrome, POTS, hypermobile spectrum disorder, and what was the other thing? She's got a lot. So yeah, we're a mess over here. And I honestly think, I suspect that she may also have relapsing polychondritis, and I have pictures for her, of her having reactions. Um, so yeah, driving an hour and a half and 2 nights in a hotel room, totally worth it, because I am going to be coming back. In well, I'm called tomorrow, make the appointment. But we're going to be coming back because we have to go to the Mayo Clinic, the both of us. I'm going to share this to my Chronically Spicy. You see, Chronically Spicy page. I have 2.1 thousand followers over here right now. And I would love to have you also follow me here. Again, benefits over TikTok. If you want to subscribe and see exclusive content on TikTok, it costs money, or gifts, whatever. YouTube, it's up to you if you want to gift or super chat or whatever. And that doesn't even, I'm not even qualified. I haven't even reached that level yet. So I have to have 1,000 subscribers and so many watch hours. But exclusive content, free, does not cost, $2.99 to $9.99 a month. And things stay up a lot longer and are much easier to find. I would highly recommend that you join me over on Chronically Spicy, and Chronically Spicy and the Spicers Facebook group. That is for everyone with chronic illness. Yes, I talk about mast cell activation syndrome a lot. Yes, I talk about latex allergy, coconut allergy, ethylene dichloride allergy, medical gaslighting, and chronic illness in general, and now POTS and EDS and dysautonomia. That's the other thing she was diagnosed with. And ADHD. Ha. Everything you were diagnosed with.
I don't remember the list most of the time. I just kind of go with it.
Yeah, she's the alphabet. It's the alphabet.
It makes it worse because I'm queer, so I probably actually am at this point.
You are the entire alphabet, sweetheart. So let's see. I'm trying to see. I can go live on Chronically Spicy and the Spicers, or on my Facebook group. No. I can go live on If I go to the, I can do it on my phone. Let's see. Actually, no, it's playing. Let's see. All right. So this appointment was made for me by a doctor who lives, who works out of the same area that I live in. And relapsing pelvic chondritis. Let's talk about that one. Well, first, let's see if I want to see what's going on YouTube on my channel. Because I don't know. Maybe it shows up later. But I don't think I like that. How come it? Because then I can't see chats. You know what I mean? See, I'm looking at my YouTube page, and here's the home page. Nope. Well, I'm thinking it's going to show up later, and I'm just not going to see the chats immediately, which sucks. If anybody's actually hanging, I know there's a few of you in here. So I'm trying to figure out how to make this work. Aside from, joining me on Facebook. I mean, you can also follow me on Instagram. I could do that. I could do Instagram Live. Let's do that. How many? Well, a lot of people don't like different apps for different reasons. So it's not easy to please everyone. However, there's only so many places and so many things and things that I can actually handle, which is one reason why it's hard for me to jump from platform to platform. Let's see.
Apparently, it's official technique for archaeologists to lick things they find to see if it's rocks or bones. Just felt you should know that because I came across that in a TikTok description.
Are you going to become an? Oh my God! I remember. I know that one.
Geologists also lick rocks, I think.
Yeah.
Except they're usually not bones.
I know that one.
That's like an official thing that they're. I don't. How do these people live for more than a week?
Well, I know a lot of people with autism have that peak pica, and
just put things in their mouth.
Yep, and have survived. All
Relevant
right.
to that, my boyfriend's eaten multiple different types of paint and can in fact tell you how they taste like.
All right.
So that adds up.
All right, so let's see. I'm looking at my latest videos. Hello. If anybody is watching, let me know. I'm here to talk about I'm in Florida right now for medical vacation. Drove an hour and a half with my daughter so that I can be seen by a specialist tomorrow about relapsing polychondritis, which is a chronic illness condition. It's a rare autoimmune disease. And I'm going to show you the post that led to that. I just went live on Instagram if you want to follow over there. Also, Chronically Spicy. Because on the free streaming service I'm using for multi-streaming. You can only go live on 2 platforms at once, and yeah, so I use my phone for. I've got my iPad charged too. I could actually um, do this on the other one on X as well. We find. Oh, I just ADHD'd myself. 1 second. What the hell was I doing? Hello, dash cam. All right. So let's go with the easy. You know what? Hand me my iPad.
What?
Hand me my iPad.
Got it.
Right there. All right. So let's share this. Let's share this instead. All right. So what is relapsing? Oh no. Oh, I remember what I was going to do. I was going to show you my chronically spicy video that led to all of this. Let's see, videos. Really? What happened to my page? Something went wrong. Refresh. Okay, here we go. There we go. All right. So share this instead. All right. This is the account. This is the post. I am live on Facebook and Pauline Campos. What's the? You can also watch it on the Chronically Spicy page, and then you can like go see what I'm sharing. But this right here, I used to think that this was just mast cell activation syndrome. But every single time I was tested for it, and I do have MCAS. However, I don't have cutaneous MCAS. That there every single skin biopsy that I got and I've had multiple. Um, every single one of them did nothing for me to help my case. They just made me look crazy because doctors thought that I was just trying to get attention. And I didn't have any extra, or my mast cell level were normal uh, on on every single punch biopsy. So while this also looks like mastocytosis, it's not, because my mast cell level there was no extra MCAS mast cell activity. The levels were normal. So someone eventually here in the comments suggested that I look into relapsing polyarthritis. And this one went crazy. If you have or suspect relapsing polyarthritis, which we'll get to in a second, this is what a major flare. This is what I looked like for 7 years straight, or about 5 years straight. Sorry. I was still eating high histamine. I was doing the bone broth, trying to heal my gut, fermented foods, um, uh, extra collagen, all of the stuff that, you know, creators and including chiropractors who are stepping way out of their lane when they start treating conditions other than those related directly to the spine and your skeletal structure. Um, yeah, that just isn't gonna work, right? So this this just made me look nuts to doctors. Hypogal, if you are on TikTok, you should follow her. She has relapsing polychondritis, and she talks about it, and was actually quoted in an article, and actually wrote an article for a teaching hospital. I was told, let's talk about what relapsing polychondritis is now. Let me share the right screen. All right. So, relapsing polychondritis. Now, if you go to look this up, don't freak out, because one of the first things that I saw that came up when I first searched it, literally, was life expectancy. And I was like, well, if it was going to off me, it's not doing a very good job, because the symptoms started when my daughter was born. And those spots, these spots over here, just to remind, all of this over here, this hurts like hell when it happens. The spots are hard. I get swollen. It's pressure. It's pain. It feels like mini. All I can say is it feels like being stabbed from the inside out, when a nurse is trying to, draw blood and hits wrong with the syringe. Like that it's extremely painful, and I looked like that for the entire time that we lived in Maine, so from 2013 to 2017, and then I still looked like that. Oh, so it was 7 years, because I still looked like that for the first 2 years, I think, that we lived in Minnesota. Um, and then symptoms were basically reactivated later. Do I have X on my? I'm just trying to find ways to be able to like talk to you guys, because hello, the charming historian. That's a very cool name. Um, you can follow me on all of these other platforms, and everything, you'll actually get to see me, because I'm not sure what's going on. I didn't. I was driving when the 1 second. I was driving when the live got cut. Had my hands on the wheel. I had the phone in a phone holder on the dash. So I have no idea what that was about. But that's okay. So, how do I App Store? Do I not have Twitter on my iPad? Probably not, because I only use it for drawing. Nope, that's pointless. Let's go to the App Store, because I'm trying to connect with more people. Oh, right. I don't have time to do that right now. All right. Let's just go to what is relapsing polychondritis. Let's go, because y'all know I have mast cell activation syndrome, dysautonomia, potential POTS, which is one of the reasons that our provider is going to be sending me and my daughter to the Mayo Clinic. That's actually after I get back to the hotel tomorrow. I am going to call the Mayo Clinic to set up the appointment for us. Basically, she wants us genetic tested to see if I have a different kind of POTS, than my daughter. And yeah, that's gonna be fun. But anyway, relapsing polychondritis. This is from Cleveland Clinic. I was told that this is an extremely rare condition, and that most patients end up having to go to teaching hospitals to get diagnosed. Here, let me see. I don't know if I can. I wish there was. Is there a way to switch the? See, there's no way. If there was a way for me to switch the camera here on Instagram, I totally would. I am sorry, but that's what this looks like. And it's so sorry about that. So you get to listen, and we'll go from there. All right. So let me see. Relapsing polychondritis. Here we go. RP, relapsing polychondritis, is a rare disorder causing inflammation and deterioration of the cartilage connective tissue. Think EDS, but like multiplied. Symptoms often include pain, swelling, and redness in the ears. And I do have plenty of pictures showing that in my phone. I will create an updated video after my appointment because, again, I am not walking into this appointment telling the doctor, yes, this is definitely what I have. But there's a very good chance that that's what it is because I got the referral. And they asked me a few questions over the phone, and they were like, "How's next month? How's next month sound?" Okay. The condition also can impact the nose, airway, and other body parts. Most people can manage episodes with medications, but rare complications can be life-threatening. And I believe that's probably where the life expectancy portion comes in because it's just there's like mastocytosis and mast cell. There's different levels of severity. So what is it? Relapsing polychondritis is a rare disorder, causes inflammation and deterioration of the cartilage. Cartilage is a connective tissue throughout your body. When I have flares, which I am currently in one right now, I can push my nose all the way up without any there's no my cartilage has said I'm not working right now. I can squeeze my tongue and this tiny, tiny, tiny little gap I have in between two teeth right here that when I'm not on flare, I cannot do. And I let's see. My ears, I can only wear the lightest earrings because otherwise my earlobes stretch. My ears don't hold masks. I have to use a mask holder. And anyway, those are some of this. And yes, I have the ear and the nose thing happen in multiple pictures. If you look over here, because it can't. Here you go. See nose, basically all of me. Nose. Yeah, there's a whole lot more. Um, forgot to switch back over there. See, so I've got the picture, and from what I've been told, um, most of people who are diagnosed with this condition because it is so rare are usually diagnosed based off of just clinically, and often based off of pictures. When I the appointment, the nurse asked me a few questions, um, and that showed me that they know exactly what they're talking about. Relapsing polychondritis tends to affect ears, nose, larynx, voice box, trachea, windpipe. Other names for relapsing polychondritis include things I cannot pronounce: chronic atrophic polychondritis, generalized or systemic chondromalacia, Meyenberg-Alter-Ulinger syndrome, relapsing perichondritis, and von Meyenberg disease. who might get RP. Relapsing polychondritis can often affect anyone, but it usually starts in people ages 40 to 60. I have had symptoms like this since everything kicked off after my daughter was born, but this started, I believe, when I was, 2013. I'd have been in my late 30s, mid to late 30s. So, yeah. How common is it? It's the condition is rare because I need to be special. Rare researchers estimate that it affects 1 in 285,000 people. That's nuts, right? What causes it? Scientists don't know what causes relapsing polychondritis. Some consider it an autoimmune disease when your immune system attacks healthy tissue, but they don't understand why it happens, which is the case with the majority of things. What are the symptoms? Hello. How you guys doing? If you have any questions, please feel free to leave a comment, and I will see if I can answer it. Let's see. So, relapsing polychondritis tends to occur in episodes or flares. Exactly what happens to me. An episode may last a few days or weeks, or they occur repeatedly for years. That's also what happens to me. The first symptoms are usually pain, tenderness, swelling, and redness in one or both ears. For me, I believe it's my left ear that gets hot and red and swollen and like cauliflower ear. It's crazy. The symptoms affect cartilage inside and outside your ears, but not your ear lobes. Your ears may become floppy. When I'm in a flare, I'm not kidding. If it's windy enough, I can literally feel them flopping in the wind. It's one of the reasons that I wear headbands as often as I do, not just because they work with my hair or when I'm wearing a wig or have a protective style in, but because my ears, they're flappy. Let's see. Other relapsing polychondritis symptoms include cartilage collapse at the bridge of your nose, which may result in saddle nose deformity. Let's see what that looks like. Share this one instead. Saddle nose deformity. Here you go. Depression in the nose. I don't have that yet. Okay. But this is not a good sign. Okay. Right. So let's go back to the other page. All right. So other symptoms, right? Saddle nose, joint pain similar to arthritis, nasal congestion, pain near breastbone. I haven't experienced pain and what? Ileana, pain and redness in your eye.
Oh yeah, that's what happens to you when I'm on my period.
Relapsing polychondritis. Right there. It could be that. So I was trying to, did you start yet?
No.
Okay, so this is the first month. For 4 months in a row, I had this start on the first day of her cycle. For 4 months in a row.
I would have by now, but that birth control we tried completely fucked that. So it's an accurate statement.
Yeah,
that is the only way to say it in a way that is accurate.
Well, let's try to not F-bomb on all the.
No, I'm not doing it on all of them.
Let's not on any. Not anymore right now. I'll let you know when I'm doing the ones that I don't care. All right. So nasal. Okay. So anyway, this right here could actually be a sign of relapsing polychondritis. That's insane. Hearing loss, tinnitus, or vertigo if your inner ear is affected. Um,
Occasionally I get random ear ringing.
so do I. I think
I'm not sure what that's specifically related to or if it's just a thing, but it happens.
I think I always have it, but I think I'm only aware of it every now and then.
I'm not sure if it's that or if it legitimately just appears sometimes and then doesn't others. It could be one of those things like with my physical pain where it's there all the time, but I only notice it if it's bad enough that I would otherwise complain.
Right. So 1 second. All right, since we invite some friends. All right, more symptoms that I had not even realized that are attributed to RP or can be attributed to RP. Rarely, someone with relapsing polychondritis might also have, heart valve issues. I'm assuming heart murmur, vision loss, and kidney disease. Great. Um, Diagnostics and testing for relapsing polychondritis. Hey, Strapless Beauty. I am talking about relapsing polychondritis and the medical vacation. I'm in Florida right now for an appointment tomorrow. How is relapsing polychondritis diagnosed? I am live streaming right now on YouTube and my Facebook page if you'd like to see the information that I'm sharing. And I'd love for you to join me over there. If you subscribe to the channel, that'd be great. I'm trying to get to 1,000 subscribers this year. So, how is it diagnosed? There's no test to diagnose or confirm relapsing polychondritis. Let me repeat that. There are no tests to diagnose or confirm relapsing polychondritis. A healthcare provider can diagnose a condition if you have at least 3 associated symptoms over time. Well, a biopsy of your ear cartilage or a blood or test might help confirm about a diagnosis. Okay, so let's go over the list of symptoms again, right? Okay. And then we will count them off. Okay. All right. All right. All right. Let's go. So we have this. Share this tab instead. All right. We have floppy ears. We have, that's one. We have episodes or flares that occur. Mine usually last for a few weeks to a few months. And they're usually triggered by either an allergic reaction, histamine mast cell reaction, or cycle hormones. Okay. The first symptoms, pain, tenderness, swelling, and redness in one or both ears. That happens to me sporadically. Came back from the Renaissance Festival one year, and my left ear was just red hot and throbbing and swollen and hurt like nobody's business, and extremely swollen. And my doctors had no idea what was going on. So that's what now 3. Cartilage. I don't have. I don't have saddle nose deformity. I don't have joint pain similar to arthritis that I can think of, because I forget. Sometimes I have to have pain symptoms and chronic illness symptoms described to me by other people before I can go, oh yeah, I actually that happens to me too. Nasal congestion. Oh, you betcha. In fact, I couldn't breathe out of my nose really at all until I started using cromolyn sodium nasal spray, nasal crom, that you can get on Amazon for like $17 for 2 bottles. It's the same thing that you have to get prescribed. And actually your body keeps more of it is active in your body, remains active in your body when it's inhaled, as opposed to the liquid vials. I think your body retains only like 5% of that. So keep that in mind. I don't have pain near my breastbone. Pain and redness in your eyes. Are we on 4 or 5 now? Let's see. Floppy ears, redness and swelling, ears and nasal congestion, pain and redness in your eye, hearing loss, tinnitus, or vertigo if your inner ear is affected. I had a major vertigo attack last year when both husband and daughter were sleeping, and literally had to inchworm my way to and from the bathroom because I couldn't even crawl. Vertigo. My inner ear was not working for me. So that's 5, right? Difficulty breathing if it affects your trachea, or trouble speaking, it affects your larynx. I'm gonna call that 6 because it happens sporadically, but it happens often enough that TikTok followers have noticed and pointed out that it's time to take my mast cell rescue meds when my voice starts cracking, like vocal cord dysfunction of some sort. So let's see. I'm going to share. Now I can finally see my live. If you want to join on YouTube, I can finally see it up there. All right, so 1 second, share to this tab. Really? I have to log in. I don't remember my account. All right, never mind. Let's go back to this page. I have to reset my Twitter, my X password. All right, so I have 6 of those. I have 6 of these. All right, so there's no cure for this. Management and treatment. How is a relapsing Pauline Campos treated? There is no cure for this condition. There's also no cure for a lot of other conditions that are considered chronic, including mast cell. Relapsing polychondritis treatment aims to ease symptoms and reduce the chance of complications. Treatment often begins with colchicine, often used for gout. I'm going to open up that in a new tab so I can look it up because I'm allergic to everything. Corticosteroids, which is prednisone. I can't take those. I'm allergic to ethylene dihydrochloride. Hey, Daryl. I am talking about relapsing polychondritis and why I'm in Florida to see a dermatologist tomorrow. Corticosteroids, ethylene dihydrochloride is in a lot of things, and that's why I can't take any of them. Dapsone is an anti-infective and non-steroidal, and NSAIDs. Okay, so I'm already using BC Goody powder in my water because which is acetaminophen and aspirin. And my doctor approved me to add it to my water when I'm having a mast cell reaction because, baby aspirin also, mast cell stabilizer. I'm not giving medical advice. I'm just sharing what I was told. So, yeah. Now let's see. But ethylene dihydrochloride is in so many things that my options are extremely limited. In more severe cases, healthcare providers may prescribe medications that suppress the immune system, such as cyclophosphamide or azathioprine and methotrexate, a type of chemotherapy against arthritis. I'm gonna bet you I'm allergic to all of this. Open a new tab. Open a new tab. People with very severe cases may require surgery, such as heart valve surgery, insertion of a breathing tube, procedures to open the airway, including laryngeal or tracheal stent, and surgery to reconstruct trachea or larynx. I'm not in that category, and hopefully I don't get there. I believe that I have the cutaneous version of relapsing polychondritis. So here's the whole list of medications, and I'm almost certain I'm allergic to everything here. I am going to be making sure I let my doctor know that what's interesting is uh, the entire Benz family of anti-anxiety medication stabilizes mast cells. It's an off-label usage, and you have to have a mast cell aware doctor to get that prescription, or it's difficult. I'm looking up something because, and I'll share it with you in a minute. There we go. I'm looking to see. Looking to see what drugs are used to treat relapsing polychondritis. Let's go to PubMed. Does that include that? I'm looking to see. Just so you know, when I'm working on YouTube or TikTok responses for people who ask questions in my video, in my comment section, this is the kind of research that I'm doing to get the proper answers. But I can only provide clickable links, I think, in the YouTube descriptions for videos. I believe I can do it in the pinned comments on shorts, and I can also do it on Facebook. I can't do clickable links over on the Clock app. All right, let's see. I know I found one. Here we go. Videos of relapsing polychondritis, Benz treatment. Here is, who is this from? Check Cleveland Clinic. Let's check this one. Is that the one I was on? Probably. So let's look at the video. It has 9,000 views. And I'm going to hit the right link. I got lots of pages open. I just got it. Here we go. All right, we're not going to watch the whole thing, but we're going to watch just a little bit. Maybe, how long is this? What does it say? Let's do this one. It's a super short one. Let's do volume. I will include the link or credit to this uh, on my in the description. Crazy, right? So it depends on where you go. I've been told teaching hospitals are usually required. I can't take any of them. Sorry, wait, if you need to. Yeah, okay, so we're gonna go back. All right, now we're gonna share this one. All right, so let's finish reading the article. Whoa, 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 whoa. Hi, no, you can stop talking. There you go. Okay, and we can stop on this one. All right, so let's go back to where I wanted to go, which is here. All right, how can I prevent RP? Scientists don't understand what causes RP, so there's no strategies to prevent it. Outlook, is relapsing polychondritis fatal? Dude, living is fatal. Okay. Relapsing polychondritis expectancy is generally good. Almost 95% of people with the condition are alive 8 years after the diagnosis. Okay, here. Let me want that's great. I've had if I have this, I've had this for at least 10 years already. So and my symptoms are obviously better than they used to be. I can't believe I actually have a mostly clear complexion. This is new. And the last time it happened was in Maine during what was apparently or potentially an RP flare. And yeah, so lovely. But it can cause life threatening complications, particularly breathing problems. I have central nervous sleep apnea, CNS, and it can cause permanent loss of hearing or vision. So far, I have no problems with my hearing. And so far, I have no problems. Well, I need to wear glasses again. I had not latex, LASIK surgery. Um, when Eliana was 10 months old after she broke like my fifth pair of very expensive glasses because I was this close to being diagnosed legally blind. So we had to pay to get my glasses thinned. Otherwise, I'd been walking around with Coke bottles for super thick glasses. So after she broke my 10th pair, I had LASIK. That was when she's 16 now, and I need glasses again. So I've been wearing I have like a very it's a prescription that is actually less than the reading glasses that you can get at the pharmacy. So but how long will I have relapsing polychondritis? Relapsing polychondritis is a chronic condition that doesn't go away, but with treatment, you may be able to make episodes less intense and less frequent. I also personally believe that the fact that I eat keto and I do low histamine keto and intermittent fasting. And actually, my best friend in Minnesota is the one who um, is one of the people who asked me just a few days ago, why don't I go back to, because I've had so many reactions lately. Why don't you go back to keto and fasting? Because you weren't having all of this happen when you were doing that. So I strongly suspect a connection between um, the diet and the lifestyle for intermittent fasting. I do best with three what they call in the community 3 times 36 or 3 times 42 or ADF, alternate day fasting. Um, Eating Tuesday, Wednesday, um, eating every other day, right? So Monday I fast. So Monday I fast 36 to 42 hours. Um, Tuesday I eat 1 to 2 meals in an 8-hour window with my family, and they are 20 grams of carbs or less. I count the carbs in my broccoli. I also so and then you fast on Tuesday, you eat on uh, Wednesday, you fast on Thursday, no, Monday, Wednesday, Friday, fast Tuesday, Thursday, Saturday, Sunday, eat, and on the weekends, I do 18-hour fasts. So I'm still fasting, but I get to have more fun with my family, and I do allow myself treats when I'm following keto, and um, it's very limited keto because of my allergies, because of my mast cell activation syndrome, because of my histamine intolerance. However, when I go back to eating like a regular person and start carving it up, I flare back up. So for this, I don't know if this is just a me thing, but I am going to ask my doctor about it. What else can I ask my healthcare provider if I suspect or have been diagnosed with relapsing polychondritis? If you've been diagnosed with RP, consider asking your healthcare provider the following questions. How severe is my condition? What medications do you recommend? Should I have tests to check my vision, hearing, airway, heart, or kidneys? Should I see any specialists? Can I do anything to strengthen my cartilage or slow down the degeneration? And no, I cannot take or drink collagen supplements because they are too high in histamines and set off reactions. Do you know of any clinical trials for this condition? When should I seek medical attention for relapsing polychondritis? If you have RP, schedule regular appointments with your healthcare providers. If you have any issues with breathing, vision, or hearing, seek medical attention as soon as possible. Don't wait for the next appointment. A note from Cleveland Clinic: relapsing polychondritis is a rare disorder that causes inflammation and deterioration of cartilage. It usually affects ears and nose, but can damage your airway and other body parts. If you have symptoms of this condition, talk to your healthcare provider. Most cases are manageable, but life-threatening complications can occur. And so this was last updated on 3/20 of 23. So Cleveland Clinic is up on this. Let's see. But see, I'm actually pretty excited because the nurse, or not the nurse, receptionist, when I called to make this appointment, asked me. I said is the doctor also familiar with Magic syndrome and Behçet's syndrome? And she said, oh, when you have Behçet's disease. And she said, "Oh, do you have sores on, like indented sores on your lips?" And I was like, "Wow, yes, I've gotten that. I don't have those now, but I've gotten that. And I don't know why they call it Magic syndrome. Oh, that's why. mouth, mouth, and you know what? Ulcers, inflamed cartilage syndrome. Let me tell you, all I'm going to say is that sometimes it hurts to walk. And that started after my daughter was born. The pregnancy, I had a complicated pregnancy, bed rest at 5 months, hospitalized 3 times for hyperemesis gravidarum. I took Zofran 3 times a day. And then I ended up in the hospital every time the insurance company would kick me off. Hello, how are you? And then I'd end up back in the ER, and they would be like, "Oh, so she wasn't kidding," and they would approve the prescription again. And then I was hospitalized again 3 times after in her first 6 weeks of life. I love you a lot. You're such a cat. Okay. All right. So magic syndrome, because I believe, and I was told by the people who I've shared pictures in the group. There's the support group, and there are doctors in that group too. And I've been told by, you know, how when an autistic person tells another autistic person who doesn't know they're autistic, because that happened to me, and then I got diagnosed like 3 years later. Everybody who's seen my pictures is like, so, you get your diagnosis yet? Magic syndrome is a rare autoinflammatory syndrome characterized by the presence of features of relapsing polychondritis and Behçet's disease in the same individual. It causes inflammation of the cartilage in the nose, ears, throat, and rib cage. I don't know about rib cage. It can also lead to recurrent ulcers in the mouth. I've had a few of those. And the other area. Some patients may also experience eye problems, joint pain. My daughter has extreme joint pain, fever, colitis, inflammation of the inner lining of the colon, what it is, thrombus something, a swollen vein due to a blood clot, or inflammation of blood vessels in the brain and spinal cord. In some cases, the disease can also cause arterial aneurysms. The symptoms of polychondritis usually occur after symptoms of Behçet's disease. Okay. What are some of the symptoms, or when do symptoms of magic syndrome begin? Symptoms of this disease may start to appear from childhood to adulthood. The age symptoms may begin to appear differs between diseases. My daughter currently has a few sores. Our sores show up during our cycles or the week before we start. And then mine would clear up after. The age symptoms may begin to differ between diseases. Symptoms may begin in a single age range or during several age ranges. The symptoms of some diseases may begin at any age. Knowing when symptoms may have appeared can help medical providers find the correct diagnosis. Let's see here. About magic syndrome. It's a rare disease, and population estimate is fewer than 1,000 people in the US have this disease. If I am wrong and do not have this condition, I need this doctor to tell me, okay, you don't have this, but we're going to find out what the problem is that has the exact same symptoms as magic syndrome. So I'm pretty freaking positive. Symptoms may start to appear from childhood to adulthood. My daughter's 16, unfortunately, starting with and she's had her. If I'm right, her first flare, she was about 9. I've got pictures. Cause GARD does not currently have. Rare diseases. does not let's see this site does not currently have information about the cause of it, and GARD is not currently aware of organizations specific to this disease. Well, guess what? We might have to start one. All right, now let's look at this is from the National Center for Advancing Translational Sciences, Genetic and Rare Diseases Information Center, GARD. If you have questions about rare diseases, you can call this number. All right, now we're going to look up Behçet's disease. Share this tab instead. All right. All right, overview. We're just going to do an overview on this. A rare inflammatory disease of the blood vessels. The symptoms could be unrelated and may include sore mouth, rashes on skin, and sores in that area. Like I said, sometimes walking is not fun. And I generally wear leggings almost every day I haven't worn denim in a long time because leggings are softer and hurt less. May be dangerous or life-threatening. Extremely rare, fewer than 1,000 cases per year in the US. Why can't I have the kind of luck that wins me the lottery twice or 3 times in a row instead of getting like smacked with 2? Now this would be my second, because I've got the trifecta for mast cell POTS, and I'm in the EDS family of hypermobile spectrum disorder. Those often appear comorbid. Now I'm looking at Magic syndrome, Behçet's disease, and RP, relapsing polychondritis. Doesn't require a lab test or imaging, lifelong condition, common for ages 18 to 35. Family history may include increased likelihood. All right, then she talks about symptoms. Mouth and that sores, rashes and inflamed eyes. Anybody? Right here? Hi. Oh my God. Pain in the eyes or joints. Yes. This doesn't hurt. It feels like I'm blinking over like dirt in my eye. And this is by Dr. Karthikeya TM, MD, internal medicine. Let's see. Rashes on the skin and the appearance of acne. Okay. Red and tender lumps on the skin. May I refer you? Oh my God. I'm pretty sure, I am almost positive tomorrow's a formality. May I refer you to this instead? Rashes. Where'd it go? I lost the page. Here we go. Let's just go here. All right. So yeah, I'm gonna say that's a yes. I miss Sally Mac. Yeah. All right. So let's go back to here. No, that's the wrong one. Oop, let's stop this. Wait, why is that still playing? There, I muted it because I can't find it. All right, so we already read everything on that. Now I'm going to check a few other things here that we can talk about for that's like in 2 different tabs. All right, so I'm going to show you if you Google relapsing polychondritis and you search images. I am not going to scroll much further than what you see here. But I've I've looked like this. My ear. Am I sharing the right page? Is it sharing? Nope, I'm not sharing anything. A second. There we go. All right, so trigger warning, just in case, like for just medical images. Okay, relapse for of inflammation. I have had my ear look like this and this, and this. Um, I have had that, and I've had that all over my face. I've had that. And this would explain why I don't have elevated mast cells. Oh, geez. Look at this one right here. Eliana. Under relapsing polychondroitis vision images. Look at his eyes.
Oh, yeah, that's what happens to you.
Yeah, that's what happens to me.
Huh.
Yeah. You only have to have 3 of the, like, I think there were 10 symptoms. You only have to have 3 of them. I have 6. Yeah. So that's all right. Yeah. So I'm pretty sure tomorrow is a formality. That's I'm almost positive. Now let's check for the Behçet's. Did we look at Behçet's? All right, symptoms. We already read that. Red and tender lumps under the skin. Yes. Visual problems such as sensitivity to light and blurred vision. Yes, but that could be a sensory thing because I'm also autistic and have ADHD for sensitivity to the light. So that one is an iffy. Oh, hi, eye redness. Now that's that. Oh boy, causes. See more. Uveitis, a symptom of Behçet syndrome, can lead to decreased vision or blindness. Vascular problems such as stroke can occur to decrease blood flow to the brain. Formation of blood clots due to inflammation of arteries and veins. I want to see what the diet recommendations are. Foods rich in vitamin E, and this is for Behçet's syndrome. Foods rich in vitamin E, such as almonds and spinach. I'm allergic to tree nuts. I'm allergic to legumes, so technically, even though I haven't reacted to almonds, I try to limit consumption. And spinach immediately dries my mouth out. It's related to one of my allergies. I forget which one. Food rich in vitamin C, such as guava and oranges. I'm allergic to both because they're citrus fruits, and I'm allergic to latex, so latex fruit syndrome. Omega-3 containing foods such as soybeans, salmon, sardines. I can't eat any of those because soybeans are a latex cross, and salmon and sardines and any fish are too high in histamines. And unless it's fresh caught, which I haven't tried fresh caught yet, I might try soon now that we live near the coast, because that's the reason most people with histamine intolerance can't eat fish, because it's not flash frozen at it has to be flash frozen directly after catching or caught and like cooked and eaten. Foods to avoid. Trans fat and preservatives laden food. Avoid sugary and high glycemic foods. Avoid refined and processed food. Avoid dairy products. Sounds kind of keto-ish to me, doesn't it? Self-care. Rest during flares. Perform moderate exercise such as walking or swimming. I walk my dogs every single day. Am I sharing the right? I'm not sharing anything. Sorry about that. 1 second. Nope. Let me find. Here we go. All right. Share this one. There we go. All right. Now you can see what I'm talking about. All right. So, Behçet syndrome has no specific cure. Treatments include medication to control signs and symptoms. Right. That is, and let's see. Join support groups. How was this diagnosed? Mayo Clinic. Behçet's disease, also called Behçet's syndrome, is a rare disorder that causes blood vessel inflammation throughout your body. This disease can lead to numerous, one second, yep, okay. This disease can lead to numerous signs and symptoms that seem unrelated at first. No, yeah, exactly. And also led to me being labeled a skin picker. So every dermatologist that I've seen since the first guy in Maine said, "You're doing this to yourself. You have skin." Yeah, I think it's called dermatillomania, and people like you can't be helped. Ever since that was put in my medical file, every single dermatologist, every race, every creed, any gender has not. I've walked into offices looking like I did in that clip that from TikTok that I showed you in my viral pinned post, and told that it was my fault. Have you thought it? Because I was doing it myself. I was causing it. It was a pick. 12 a.m. That I was causing the cycle by picking at my skin, but I wasn't picking at clear skin. I never have. Hi, Vesper. How are you? Capillary refill. I did take my IM, but 1 second. And I'll explain in a second. Capillary refill. That was pretty good, I think. So yeah, I don't know what happened with TikTok. We'll figure that out later. Behçet's disease. I took my 50 ml intramuscular Benadryl at 10 o'clock. Actually, no, I took it at like 10:30, 10:40 because I was busy. I had to walk the dogs. So I was really feeling it by the time I took it. But I'm approved to take 50 ml of intramuscular Benadryl. We'll talk about that. I'm going to show you something in a minute. I'm taking 50 ml of intramuscular Benadryl. I'm approved to take one every 8 hours as needed for helping to control my mast cell symptoms. And let's just say this medication for me is making a huge difference because when we're not dealing with PMS and hormones, I can do 150 in the morning and 150 at night, and I can and I'm super stable. I'm less reactive than I usually am. I'm good for me. During cycle time, I generally have to do 3 a day. But I was also told that I could split it and do 25 every 4 hours. It's just that the max is 50 ml in, I think, a 6 to 8 hour window. All right, Behçet's disease. The reason that my eye looks like this could potentially be one of the reasons one of this could actually be a symptom of relapsing polychondritis and Behçet's syndrome, um, which are two of the three reasons I'm going to see the dermatologist specialist in Florida. Have sweet dreams, and I'll update later on TikTok with this. Areas commonly affected by Behçet's include mouth that look like canker sores. They begin as raised round lesions in the mouth that turn into painful ulcers. I get those occasionally. The sores usually heal in 1 to 2 weeks, though they do recur. Skin. Some people develop acne like sores on their bodies and then get medically gaslit by their doctors. My thoughts, not written in the article. Others develop red raised and tender nodules on their skin, especially on their lower legs. Yep, I've had a bunch of my legs. That area, red open sores can occur on that and that. The sores are usually painful and can leave scars. Fun times. Eyes, inflammation in the eye, uveitis, causes redness, pain, and blurred vision, typically in both eyes. For me, only it's just my right eye. And it's interesting to me that before my daughter, she did a 2-month trial period with birth control to try and help control her PMDD and the seriousness of how badly her cycle affected her. It just made it worse. So she chose to stop, which is fine with us because we weren't going to tell her no. And let's see. I'm going back to the right. There we go. All right. But what's interesting to me is that this, for 4 months in a row, this started the same day that her cycle started, and it was gone by the time she finished. This is the first month that this has started, not on the first day of her period, even though she's symptomatic with, obvious PMS. But it's the same time of the month. So I don't know. In people with Behçet's disease, the condition can come and go. I had the same thing happen with this kind of thing happening around 7 years ago when we lived in Maine, and happened for probably off and on for probably 2 years. And doctors couldn't figure it out. Joint swelling and pain affect the knees in people with Behçet's disease. The ankles, elbows, or wrists also might be involved. Signs and symptoms can last 1 to 3 weeks and go away on their own. Blood vessels. Inflammation in veins and arteries can cause redness, pain, and swelling in the arms or legs when a blood clot results. I wouldn't even know what that feels like if it's happening right now. I couldn't describe an allergic reaction when I was having anaphylaxis when it first started. But that's a pretty common problem for people who are neurodivergent. We describe experience and describe pain differently than neurotypicals. I didn't walk in and say, "Doctor, I had a banana and I started swelling, so I must be allergic. I think I'm allergic to bananas. Can we confirm this?" Instead, I walked in like, I don't know, because I forgot I ate a banana, and now I have all of these spots I call them my angry spots because they hurt. And I described things sensation first like a child would. And That's not uncommon for neurodivergent adults. Inflammation in the large arteries can lead to complications such as aneurysms and narrowing or blockage of the vessel. Lovely. Digestive system. A variety of signs and symptoms can affect the digestive system, including abdominal pain, diarrhea, and bleeding. Brain. Inflammation in the brain and nervous system can cause headache, disorientation, poor balance, or stroke. Hey, Eliana, one of the symptoms of Behçet's disease, disorientation.
Mm.
When I'm all
Mm.
possibly. When to see your doctor? Well, hell, right away. If you have or suspect Behçet's disease, wow. Make an appointment with your doctor if you notice unusual signs and symptoms that might indicate Behçet's disease. If you've been diagnosed with the condition, see your doctor if you have new signs and symptoms. This is from the Mayo Clinic. Now, here's my disclaimer on this. Be prepared for, I would honestly suggest joining, finding and joining the relapsing polychondritis Facebook support group. I'm sure there's more than one. And if there's just the one, then it should be easy to find, because they can then help you find a doctor in your area who understands and is aware. It's like you need to have an MCAS aware doctor. You need to have a doctor. Hi, how are you? You need to have a doctor who is aware of what RP, Behçet's disease, and Magic syndrome are. Otherwise, you're going to go through 16 years of medical gaslighting hell, be told that you're crazy, that you're causing it yourself, that you're picking at your own skin and causing the cycle to continue, and could potentially be labeled as having fictitious disorder, which happened to me, and I'm still trying to get that out off of my records. So that's that. Let's check medications real quick, and then we will call it a night for this topic. All right, this is for a potential treatment for relapsing polychondritis from the Cleveland Clinic. Colchicine tablets. Let me get to that page. All right. Colchicine prevents and treats gout attacks, painful inflammatory arthritis, and familial Mediterranean fever, decreases inflammation and reduces the buildup of uric acid in joints. And the brand name is called Colchris. What is this medication? Well, we already read that. What should I tell my team before I take this medication? If that you are prescribed or it is recommended that you take colchicine for relapsing polychondritis. They need to know if you have any of these conditions: kidney disease, liver disease, an unusual reaction to colchicine, other medication, foods, dyes, or preservatives. Okay, that means I can't take it. Because it probably contains ethylenediamine dihydrochloride, which is in all dyes, and preservatives could mean ethanol hydrochloride, and it could also mean polysorbate 80 and or other coconut derivatives. So this one's probably out. How should I use this medication? Well, for those who can take it, by mouth with a glass full of water, follow the prescription label, blah 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 blah. If it upsets your stomach, take it with food, regular intervals. Patients over 65 years old may have a stronger reaction and need a smaller dose. It kind of sounds like with MCAS, where doctors have to titrate you up, like start at the tiny baby dose and move you up very, very slowly. It took me 6 weeks when I started the liquid version of the vial version of cromolyn sodium. It took me 6 weeks to start. I started at a quarter vial, and it took me 6 weeks to get to 2 vials 4 times a day. Let's see. What if I miss a dose? Take it as soon as you can. All right. So I'm gonna say, let's see, ingredients. Can I find that? The side effects. Those sound like fun. Right there. Okay. Let's see. No, it does not have that. So now let's look up colchicine ingredients. I'm telling you, I am like the queen of rabbit holes. What are the ingredients? Okay. Share this tab instead. All right. Colchicine is an alkaloid used to prevent or treat gout attacks. Got that. All right. And potentially relapsing polychondritis. Okay. Common side effects include all of this fun stuff. Contact your doctor if you have any unusual breathing, severe diarrhea, vomiting, muscle weakness or pain, numbness, pale or gray color of the lips, tongue, palm of hands, signs of infection, fast heartbeat, shortness of breath, changes in the amount of urine. Dosage for colchicine. All right. Yep. Well, it doesn't matter if I can't take it. So let's see. Additional information. Our colchicine provides a comprehensive view of the drug description. Okay, here we go. Chemical name for colchicine is SN5679 tetrahydro123 tetramethoxy9 oxobenzo heptalin 7-il acetamide. The structural formula is that right here. No, just that. All right, colchicine consists of pale yellow scales or powder. It darkens on exposure to light, soluble in water, freely soluble in alcohol, and slightly soluble in ether. Colchicine capsules are supplied for oral administration. Here we go. Each capsule contains 0.6 mg colchicine, and the following inactive ingredients. Yep. Colloidal silicone dioxide, lactose anhydrous, magnesium stearate. That's a coconut derivative. Potentially, most often, unless you can verify it through your pharmacist, and most often companies can't guarantee, which. If you're talking to an honest pharmacist, they're gonna say, well, we can't always, our supplier changes, right? So yeah, that's not going to be a certain thing. Microcrystalline cellulose, sodium starch glycolate. The capsule shell contains gelatin, which immediately makes me projectile vomit. Purified water, titanium dioxide, Erythrocin, brilliant blue FCF, yes, it does, and quinoline yellow, yes, it does contain ethylene tetrachloride, because ethylene tetrachloride is in all dyes. So that's fun. So that one's out. Let's cross that off. Methotrexate. Let's see what it looks at. Let's look up methotrexate as a medication treatment for relapsing polychondritis. We are just going to look at the basics information, and then we're going to look at the ingredients. Methotrexate treats inflammatory conditions such as arthritis and psoriasis by decreasing inflammation, reducing pain, and preventing long-term injury to the joints and skin, and can be used to treat some types of cancer. It works by slowing down the growth of cancer cells. The medicine may be used for other purposes, so off-label usage. Common brand names, Rumatrex and Natrexol. All right. They need to know if you have any of these conditions, including fluid in stomach or lungs, liver disease, lung disease, radiation therapy, ulcerative colitis, unusual allergic reaction to methotrexate, other medications, foods, dyes, or preservatives. That would automatically take me off the list. If you're pregnant or breastfeeding, all right, let's see what's in it. Let's just look up methotrexate. Cut to the chase. Actually, no, we don't need to, because food, dyes, or ingredients. So yeah, that's gone. All right, which one was open? This one here. All right, we don't need to look up at saddle nose. We already talked about relapsing polychondritis, which was first described in 1923. And yeah, this is definitely, good Lord. I don't know if I'm going to be excited, or I think I'm going to be excited, but I also, if I'm right, but I also think I might need to therapy shop tomorrow after the appointment, because I've been diagnosed with a lot in the last year. 2023 was huge. I was diagnosed with methyl activation syndrome. I was diagnosed with dysautonomia. I was diagnosed as autistic, and I was diagnosed with hypermobile spectrum disorder, and I'm being sent to the Mayo Clinic for genetic testing with my daughter, because she was also she has POTS, and my provider wants to know if I have a different form of POTS. That was just 2023. Then this happened. And I mean, well, it has started a long time ago, but I thought it was all mast cell. I also have been told that I need to probably get an MRI and a brain scan, because I'm having, on occasion, usually tied to hormones or an allergic trigger, symptoms that appear to be absent seizures. And if you look through my TikTok profile, or I have to create a playlist on my YouTube channel here for, or I don't have to check if I already did, a playlist for potential epilepsy. I have done 2 videos on that, but I need to update, because some of what I've read tonight could explain that. It might be related to, those symptoms might be related to, or the relapsing polychondritis could potentially explain that although my doctor wants, and this makes sense, wants to clarify and eliminate possibilities. So right now, in 2024 or 20, yeah, and then 16-year-old gets diagnosed with MCAS, POTS, EDS, hypermobile spectrum disorder, and ADHD. I was diagnosed with ADHD at 33 and told my doctor she was ADHD too, because she's just like me. And they were like, no, she's not. She's just gifted. And then I was like, okay, doing more research, and I'm like, wait a second, she's autistic. And they were like, no, she's not. She's just gifted, and gifted because they're difficult. Stop trying to make something out of nothing. And I finally found a doctor who was like, yeah, we will get you a referral to a psychiatrist for an evaluation 9 months later. She was diagnosed autistic at age 9. It took until she was 16. And the provider that diagnosed everything else for the ADHD to be diagnosed, when we are basically what I refer to as brain twins. Because we are way too much alike. And I feel really bad that I passed on so much. And she got, and on top of all that, she got celiac disease from her dad. So, like, this is that's a lot. That's a lot. Anyway, I'm going to do shorter versions of these. I might go through, I don't have the patience to go through the entire video and edit it into shorts, or if I might just, in the next few days, do short updates, 10 minutes or less, on TikTok, and then just upload to YouTube, and do it that way. But first of all, please subscribe to the channel if you would like to support me as a content creator. Please also check out my links. I'm going to add my link tree in the description box, and as many of the links that a reference link for relapsing polychondritis, Behçet's disease, Magic syndrome, and uveitis, inflammation of the eye. And we can talk about what happens tomorrow, after tomorrow. But you only need 3 symptoms to be diagnosed. I have 2 years worth of pictures, and at least 6 of those symptoms for relapsing polychondritis, and I seem to fit the bill multiple times over on Magic syndrome and Behçet's. And I suspect that my daughter has the very beginnings of Behçet's or relapsing polychondritis, because she gets sores that I have pictures of. So, like I said, anyway, please please subscribe, and help support me as a content creator. It's free to subscribe on YouTube, which is the beautiful part, because on TikTok, you have to pay to subscribe to your favorite content creators. And I am trying to educate and advocate for chronic illness and chronic illness awareness and medical gaslighting awareness. because I have been through 16 years of absolute hell, um, with doctors literally telling me that I it was all in my head. How many of us have heard, as chronic illness patients, how many of us have heard, are you sure it isn't just anxiety? What if it's depression? Maybe you should eat less and exercise more. It's all in your head. Have you tried yoga? What about going keto or vegan or plant based or insert whatever diet here? So many times patients walk into their doctor's offices looking like this and being told that it's all in their heads. Okay? Uh, Also being told that, let's see, let's find, here we go, medical gaslighting. I that would be redness in both eyes, but I don't know if that's because I'm crying. Because I've again, right before this picture was taken, was told that nothing was wrong with me, and it's all in my head. Um, and to stop asking for testing for mast cell activation syndrome. Do you see the source? Do you see the redness in my eyes? You see the redness and the flares here and the sores here. And you see what I'm saying? Um, and I am being told this is my fault. Like so many of us. Look at this. I forgot to take my intramuscular Benadryl before bed. I just started taking that, 4 weeks ago? I've lost 11 pounds of inflammation in 4 weeks. I have mast cell activation syndrome. My doctor suggests, a registered nurse friend suggested that I ask my doctor about intramuscular Benadryl. Um, and my doctor, my provider agreed that to give it a shot and see if I responded better to that. This is me, but I forgot to take it. Just take three. I can take up to three in an 8 hour, every eight, up to three, one every 8 hours as needed, right? I forgot to take it before bed one night, and that's how I woke up. 30 minutes later, gone. And yes, and it's still all in my head. Let's go over, and let me show you one more thing. This is how I know when I'm in a flare. Watch this. 1 second. You see this? All right. That. Right. See this? This is my natural hair. The only way I could explain this to doctors before was I don't know how to say this other than I know that everything's back to normal-ish when I wake up and my hair is soft and curly and kinky again, and not like that because we have collagen in our hair too. So that's my sign. That's that for me. That's one of my biggest signs. Um, yeah, month 4. But that was that we had confirmed my daughter did start her cycle that day, and I got that, and that's so. What and a commenter, follower suggested that I look into getting examined for yet another condition called vicarious ocular menstruation, which could be a sign of having what's it called? Not always. I forget. I forget what it's something that a lot of women have. It's a common issue. I'll look that one up. But basically, I might have my I might be having a cycle instead of you along with me like that could be what's happening. One second. Um, and yet all of this is going on, and I have doctors tell here. How's that for his swing player? I'm as pink as my hat. Let's see. Scroll down a little bit and just see. That's when I started taking cromolyn sodium nebulizer. And then all my allergies. So yeah, like I'm both looking forward to and dreading tomorrow. But I will update and I will hopefully leave with answers or at least a clear path for what steps to take next if I'm wrong and it's not these conditions. Because like I said, I go in and I tell doctors, okay, I have multiple symptoms that match XYZ condition. I suspect this is what I have. Can we confirm or rule out? And if it's not that condition, can you help me find out what it is? And that's exactly what I'm going to say to the doctor tomorrow. And crossing my fingers that we get somewhere. Please like, share, and subscribe. Leave a comment. I will reply. Have a great night, and I will see you in the next video. Have a good night. All right, let me do 2 shorts real quick. I have to do them on my phone because the thing that I learned with actually I can just do them on here and just yeah. But I only want to do this on YouTube. Edit off. Just YouTube. Okay. What channels? Other channels are there? Because the cool thing is the live. I like that the lives stay up and people can like watch them later. All right. Oh, shut up. Connect X. That's probably wrong. Oh my God, that's right. Nope. I do not want to create a new account. Phone number or username. You're not find your account. All right, it's fine. Username. I hate that. Screw that. All right. I'll just share that later. What is Telegram? All right. Let's just do it on YouTube. All right. If I do it on YouTube, I can't. Let's see. Let's see. We'll go with the short versions here. All right. I did not realize I didn't end the stream. I have to end it so I can do a couple of shorts. Have a great night.